Ansari, thank you so much for joining us this morning. Now, you've got an eye model in front of you and made a joke earlier on and said, I feel like I'm in high school. But I mean, our eyes are important, Dr. Ansari, you would agree. But how important is it? Now, you got a model, maybe you'd like to show us a little bit. Talk to us about our eyes.
This is just a model for the eyes, and it shows the cross-section of the eye and how it looks like. And in fact, regarding the importance of eyes, there was a study that was conducted in the United States in which they wanted to ask the general public how important their eyes are. And most of the respondents responded that they would feel as handicapped as if all of their limbs, both hands and both feet, work out if they lost both of their eyes. So eyes have a very strong role in our lives and has a lot of effect on our health, being, and body image and life. Now, this is the front of the eye from where the light enters. This is the cornea, which is transparent and usually seen as brown. From like my eyes brown, or that brown, black. So this is the cornea from where the light enters, and then it gets focused. Most of the power of the eye is from the cornea, and then it is further refracted or focused onto the back of the eye with the lens. And then this is the screen of the eye, or the retina, on which the images are formed, and these images are then perceived by the brain with this optic nerve. So this is how it works. There are about 1 million nerve cells in this small stalk.
Wow. So is there a proper way to clean the eyes, doctor?
I think there's not a proper way. I wouldn't say there's a proper way, but yeah, you should keep your eyes clean. There's few things that you should always be careful about. That you should not use dirty hands while rubbing your eyes. You should try not to rub your eyes a lot, because a lot of people, they try to rub their eyes on and off. Even if you're feeling the urge to scratch your eyes, it's better that you wash your eyes with cold water, or maybe use an ice cube. Close your eyes and put an ice cube on it rather than scratching it too much. And do not put water inside the eye. A lot of people do that, which is when they come to me in my clinic and they tell me that their eyes are very irritated, and they clean their eyes 3 or 4 times a day with fresh cold water. But the water has a different pH value. That's the chemical value as compared to the tear film, which our normal eyes have. And when you're going to use fresh water inside your eyes, you might feel better for about 5-10 minutes, but your eye is going to react. It's going to get more inflamed. It's going to get more red once you've done that. And these people then come back with the perpetuating problem that their eyes are red, they're swollen, whatever they do, it doesn't give them the comfort.
So what you're basically saying is, if I feel an itchiness, or if I feel that there's something in my eye, don't take water, and is that what you're basically saying?
Look, if you have something in your eye, then it's safe to clean it with water, because if something's spilled inside your eye, or if there's something, it's safe to clean it with water. That's the first thing you should do. Use plenty of water to flush it out. But even if you're still feeling it, then it's best that you seek medical advice. You go to a doctor.
Right. Now, diabetes is a major health problem in Fiji and in the Pacific, and according to International Diabetes Foundation, a Federation report, 37% of adults with diabetes in the world are from the Western Pacific. Now, diabetes and having eye problems, is that linked?
Yes, definitely. A lot of diabetics in Fiji probably do not understand that diabetes affects their eyes. But because when they come to us, it's already very late, because diabetes affects these vessels which are at the back, these blood vessels which are at the back of the eye, and when the diabetes affects them, the new blood vessels, they mushroom up. And because eye is not supposed to accommodate any new blood vessels, because the function of eye is to see and blood vessels cannot see, these blood vessels are very flimsy, they bleed, and the person can lose their vision like that. Unfortunately, if we have a retinal detachment or severe bleeding inside the eye, there's no treatment available in Fiji, and these people have to go abroad for treatment, and the cost of surgery ranges from 10,000 New Zealand dollars to 15,000 New Zealand dollars, which is a lot. So the thing is, these patients need, or any diabetic has to get their eye checked at least once a year with the drops, because the doctor has to put in the drops and have a look at the back of the eye. So even if you have good vision and if you're diabetic, that does not mean that your eyes are not at risk. You can still lose your vision like that if you have diabetes. So you have to get your eyes checked regularly.
I think that's a very important message, especially for our viewers this morning, knowing that if you have diabetes but you feel like your eyes aren't affected, you still need to see the doctors. And the Pacific Eye Institute and Fred Hollow's Foundation New Zealand, of course, together in collaboration with the Ministry of Health and Medical Services in Fiji, actually launched a mobile eye clinic, Doc, last year, and I think we also brought that up on the news as well. Tell us about the free eye services that this mobile eye clinic offers to people who feel the need to get their eyes checked.
Just check my phone. No.
Probably there's a question for you, Doc, there.
Right, sorry.
No worries.
This project was launched last year, and the services, because it's a state-of-the-art mobile eye clinic. It's not a bus. It's a trailer. It has its own operating theater. It has laser services. It has it dispenses glasses. So it's a comprehensive eye care, and it's for free. So I would really suggest that the people in Fiji make use of this service, because we usually go, we start rolling out these services inside the Central Division. And this year, for about 9 months, we will also, 9 weeks, we will be going to the Western Division with our current outreach services, and to Northern Division, to Lambasa as well. But mainly it is going to be situated in Vanibukasi, Korovo, Naitasiri, and Nabwa areas, and people from these locations can come to Mobile Eye Clinic and get their eyes checked for free and get all the services for free. Their surgeries if required, their lasers if required. So everything is for free.
Okay.
So how do they find out this information of where you'll be at?
Yes, we usually give this information to the hospitals, because we're based in the subdivisional hospital. Usually we take it there, park it there. And our teams will be going out to do the screening. And this year we are trying to liaise with Digicel if they could send out the mass messaging to people in a certain area, so that we can remind them and inform them that the service is there. They just need to come and use it.
And Doc, we know for a fact that here in the Pacific, our men and women love going out to sea, not only for diving but for fishing as well. Some advice on keeping their eyes safe?
Yes, well, in Pacific, a lot of people do not wear contact lenses, so probably that's fine. But if you are wearing contact lenses, do not wear contact lenses when you're swimming or diving. Yes. Or even while taking a shower, I would suggest that take your lenses off, because water contains some organisms, even freshwater, pool water contains some organisms, tap water contains some organisms that can trap between your lenses and your eyes and can cause blinding complications. People can lose their eyes. Otherwise, it's safe.
Yeah. Okay. Well, thank you so much, Dr.
Just one more
Ansari.
question. How soon is this eye clinic going to start?
Yes, we're going to start from February again. This year, resume our services from 1st of February, and we will be based for about 7 to 8 weeks in Vanibukasi. Then we move.
All right.
Yeah.
So there you go. You heard it right from Dr. Harris Ansari of the Pacific Eye Institute this morning. Thank you so much for joining us, Doc, and for giving us some very important tips there. I had to look back at Tai the last one, because
no.
Yeah, I'm gonna say this. He actually went out swimming, Doc. He went out swimming, probably enjoying the sea, and he forgot to take off his lenses and the contact lens, and he lost them. So I had to go get a new pair. So that's why on Monday I had to almost burst out laughing. Well, sorry, not that. No offense. But he kept looking up closely because of that. So now you heard that you're not supposed to go out swimming with your contact lens.
I'll take it off now.
That's correct.